Don't wait until it's too late. Your body may already be warning you. Doctors encourage older adults to report new or persistent symptoms, rather than assuming they're caused by aging alone. One, sudden memory changes. Occasional forgetfulness is common, but sudden confusion or memory problems that interfere with daily life should be evaluated promptly. Some causes are treatable, and early assessment can make an important difference if you or a loved one begins getting lost in familiar places, repeating the same questions frequently, or struggling with everyday tasks that were once routine. Don't assume it's simply a normal part of aging. A healthcare professional can help determine the cause and recommend appropriate next steps. 2. Swollen legs or feet. Swelling in your legs, ankles, or feet may seem minor, but it shouldn't be ignored if it's new, persistent, or getting worse. Fluid buildup can have many possible causes, including problems with the veins, heart, kidneys, liver, or certain medications, while occasional, mild swelling can happen after sitting or standing for long periods. Ongoing swelling deserves medical evaluation. If the swelling appears suddenly, affects only one leg, or is accompanied by pain, redness, or shortness of breath, seek medical care promptly. 3. Persistent fatigue. Feeling tired from time to time is normal, but constant fatigue that doesn't improve with rest is not something to ignore. Persistent tiredness can be associated with anemia, thyroid disorders, heart disease, poor sleep medication side effects, or many other medical conditions. If low energy begins interfering with your daily activities, it's worth discussing with your healthcare provider. 4. Shortness of breath. If everyday activities, such as climbing stairs or walking across the room, suddenly leave you out of breath, don't assume it's simply because you're getting older. New or worsening. Shortness of breath may be related to heart, lung, or other medical conditions. Seek immediate medical attention if it's severe or accompanied by chest pain. 5. Frequent falls. Falling once doesn't always mean something serious, but repeated falls are not considered a normal part of aging. Poor balance, muscle weakness, vision problems, certain medications, or neurological conditions may all play a role. Identifying the cause early can help reduce the risk of future injuries. 6. Loss of appetite. A reduced appetite that lasts for days or weeks can lead to poor nutrition, muscle loss, and weakness. It may also be linked to medication side effects, dental problems, depression, or other health conditions. Mention any lasting changes in appetite to your healthcare provider. 7. Difficulty walking. If walking becomes slower, more difficult, or less steady than usual, don't simply blame age. Changes in mobility may result from joint problems, muscle weakness, nerve disorders, or other treatable conditions. Early evaluation may help maintain independence. 8. Persistent dizziness. Feeling dizzy occasionally can happen, but frequent or ongoing dizziness deserves medical attention. It may increase the risk of falls and could be related to blood pressure changes, medications, inner ear disorders, or other medical conditions. 9. Hearing changes. A gradual decline in hearing is common with age, but sudden hearing loss or rapidly worsening hearing should be evaluated promptly. Addressing hearing problems early can improve communication and overall quality of life. 10. Sleep changes. Occasional restless nights are common, but persistent insomnia or excessive daytime sleepiness shouldn't be ignored. Poor sleep may be related to medical conditions, medication side effects, or sleep disorders that can often be treated. 11. Unexplained weight loss. Losing weight without trying may seem harmless, but after age 75 it deserves careful attention. Unintentional weight loss can result from poor nutrition, digestive disorders, medication, side effects, depression, thyroid disease, or other medical conditions. Doctors generally recommend evaluation if someone loses around 5% or more of their body weight over several months without trying. Finding the cause early may improve treatment options and help prevent further health problems. 12. Chest discomfort. Chest pressure, tightness, or pain should never be ignored, even if it comes and goes. While not every episode is caused by heart disease, chest discomfort can sometimes signal a serious medical emergency. If the discomfort is severe or occurs along with shortness of breath, sweating, nausea, or pain spreading to the arm, jaw, or back, seek emergency medical care immediately. For milder but recurring symptoms, arrange a medical evaluation as soon as possible. 13. Blood in stool or urine. Seeing blood in your stool or urine is never considered a normal part of aging. The cause may range from infections or hemorrhoids to kidney stones or other medical conditions that require treatment. Even if the bleeding stops, it's important to let your healthcare provider know so the underlying cause can be properly evaluated. 14 vision changes. Sudden blurry vision, partial vision loss, double vision or seeing flashes of light should always be taken seriously. These symptoms may be caused by eye conditions or other health problems that require prompt medical attention. Early treatment can sometimes help preserve vision and reduce the risk of permanent damage. 15. Persistent pain. Pain that lasts for weeks or continues to worsen should not simply be accepted as part of getting older. Ongoing pain may be related to arthritis, nerve disorders, fractures, or many other medical conditions. A proper medical evaluation can help identify the cause and determine the most appropriate treatment. Paying attention to persistent pain can improve comfort, mobility, and overall quality of life. 16. Persistent cough. A cough that lasts for more than a few weeks should not be dismissed as a normal part of aging. It may be caused by infections, chronic lung disease, acid reflux, medication side effects, or other underlying medical conditions. If the cough is getting worse, produces blood, or is accompanied by weight loss, fever, or shortness of breath, seek medical attention promptly. Early evaluation can help identify the cause and determine the appropriate treatment. 17. Changes in bowel habits. A lasting change in bowel habits, such as persistent constipation, diarrhea, or a noticeable change in stool size or frequency, deserves medical evaluation. While diet and medications can sometimes be responsible, these symptoms may also be associated with digestive disorders or other medical conditions. If the change continues for several weeks or is accompanied by abdominal pain, weight loss, or blood in the stool, don't delay speaking with your healthcare provider. 18. New tremors or shaking. A new tremor or shaking in the hands, arms, or other parts of the body is not something to ignore. Tremors can have many possible causes, including medication side effects, thyroid disorders, essential tremor, or neurological conditions. If the shaking is becoming more noticeable, interferes with daily activities, or appears suddenly, a medical evaluation can help determine the underlying cause and whether treatment is needed. 19. Confusion that develops suddenly. Sudden confusion is never considered a normal part of aging and should always be taken seriously. It may be triggered by infections, dehydration, medication reactions, low blood sugar, or other medical emergencies. If an older adult suddenly becomes unusually confused, has trouble recognizing familiar people or places, or behaves very differently than usual, seek medical attention as soon as possible. Prompt treatment may prevent serious complications. If the underlying cause is identified early,